Hi, everyone. Thanks for joining us on the Nikki Bostwick Unfiltered Podcast. Today's guest is Dr. Elisabeth Crain. Hi, Elisabeth. So wonderful to connect with you. Thank you for coming on.
Thank you so much for having me.
So Dr. Elisabeth Crain is a distinguished psychotherapist and mental health expert. She's based here in Southern California, where I am. And you coined the term shrink for the modern human, which I'm really excited to learn more about. She just specializes in a broad spectrum of contemporary psychological issues, including women's and maternal mental health, trauma-informed therapy, EMDR, narcissistic and borderline personality disorders, which we'll be talking about today, and the difference of the two, relationship challenges, anxiety, self-esteem, burnout, all the things. And she has a private practice where she supports clients of all ages. And she uses person-centered and psychodynamic therapy to empower all of her patients to become psych savvy in their own lives, which I love. And I'm assuming that means that you help people just to learn enough about themselves where they can navigate each situation and not always have to lean on a third party and go to therapy for the rest of their lives. But that's what I'm assuming. So I'm curious to learn more. And yeah, it's so wonderful to meet you.
Great to meet you too. Happy to be here.
So you talk a little bit about like axis 1 and axis 2. Is it axis or axes? Tell us a little bit about that. In terms of mental.
Our Bible in the shrink world is the DSM, and that's where all the mental disorders live. And in there are the axes. So axis 1 disorders are things like generalized anxiety disorder, OCD, anything under the anxiety spectrum. You'll have bipolar disorder. And then axis 2 disorders are going to be personality disorders. And those have 3 different axes. And those are actually where borderline personality disorder lives, narcissistic personality disorder lives, histrionic personality, antisocial personality, to name a few. And so we treat axis 1 and axis 2 disorders quite differently, because personality disorders in the axis 2 sphere are much harder to treat. Hence the word personality disorders, right? It's inherent in someone's personality. And so it becomes a lot trickier to navigate that and work with people. It's not as easy to tackle those issues. So that's why narcissism and narcissistic, and borderline personality, they're challenging to treat.
I'm sure. I mean, I like have so many questions. I don't even know where to begin. I want to start with the more common. I mean, I guess maybe would you say that just the general like anxiety, depression is much more common than a borderline personality disorder, or would you say that that's just as common?
So I would say generalized anxiety disorder is sort of the gold standard of our society, right? I mean, anxiety, in some ways you can normalize it. You have to have anxiety to get out of bed in the morning, to brush your teeth. So anxiety is normal to some extent. It helps us navigate our lives and get through our day. Without it, we wouldn't be able to do the things that we do. It becomes problematic when it interferes and impedes with our daily living. And so that's when the anxiety disorders start to kick in, and there's various ones. But anxiety in and of itself, I always like to try to normalize it, that like people, get frustrated with the fact that they struggle with anxiety, but it's so common. And it's actually necessary in a lot of ways for our living to have anxiety. It protects us in a lot of ways. I mean, think about how our evolution and how we evolved. Anxiety protected us from predators back in the day. So I always sort of try to normalize anxiety for people or people who struggle with it. Yes, it's treatable, and, there's different iterations of it that people struggle with. But when you're looking at the personality disorders, like narcissism or borderline, those can have what we call comorbidity with anxiety disorders. So somebody who struggles with, let's say, OCD can also have narcissistic personality disorder. Someone who has borderline personality can also have generalized anxiety disorder. So sometimes they go hand in hand, and you're working with a multitude of things with people.
When you see patients that have borderline or narcissistic personality disorder, is that where you see people like manipulate? I mean, can they manipulate you as the therapist?
Sure. Anyone's able to manipulate anybody.
Yeah. What's it like to navigate through that and like offer treatment? And what does treatment look like?
Right. I mean, when people come into therapy, it's elective, presumably, right?
Yeah,
Sometimes
that's what I was
it's
going to say, is because in some situations it might be a family is bringing someone to you, right? Not necessarily elected, but pushed on them to go see you. So like the difference between that, a treatment for that.
right. So, people who have narcissistic personality disorder usually do not seek treatment, unfortunately. In fact, they are the ones that send everyone else in their family to treatment to seek it because they believe everyone else in their life is the problem. So it's actually quite uncommon to find people with NPD electively seeking out treatment or therapy for themselves.
That's really interesting. Okay, because it's like the first step is to acknowledge that you play a role in it, and narcissists don't tend to acknowledge that, right? But they can.
It's on a spectrum. So, like when people say, nowadays narcissism is such a hot topic, right? Everyone's like,
Yeah,
that
it's like
person's a
going
narcissist.
around. Yeah.
Right. And the term is getting thrown around pretty cavalierly. And I try to admonish people like to look at it as more of a spectrum, right? Some people may have degrees of narcissism, but to actually have the disorder, narcissistic personality, you have to meet criteria, 5 out of 8 criterion to be diagnosed with that. So some people might have like 2 of the 8. And so that doesn't qualify them as somebody who has narcissistic personality disorder. They might be narcissistic, but they don't have that actual personality disorder. And so it gets confusing because now people are seeing signs of narcissism in individuals, and then they'll say, you're a narcissist. And it's like, well, maybe it's not necessarily all of that. Maybe they have some qualities of that, but they're not necessarily of that diagnosis.
Okay. What are the qualifications?
For narcissism, I mean, lack of empathy is huge. You're really going to see people who, when you go to them and you try to explain your problems, they're not going to want to hear them. They're not going to get it. You're not going to get a lot of empathy out of them. It's a broad spectrum, but that's one of the cornerstones is lack of empathy for other people, right? We have grandiose sense of self. So people who have narcissistic personality disorder will have a conflated sense of self to mitigate actually an underlying world of shattered dreams and hollowness. And a lot of people don't understand that. I've tried to bring some empathy into the narcissistic sphere because we're really dealing with people who have childhood wounding and it's something that happened to them. I don't think people are born with narcissistic personality disorder, right? And so being able to find compassion while also holding boundaries is really key to mitigating those relationships.
That's interesting. So it's not necessarily something that's inherited. Where would you say borderline personality disorder can be? Like, do you think that people can be, I mean, what's the difference between that and bipolar?
So bipolar disorder is, well, there's 2. There's bipolar 1 and bipolar 2. And those are totally different.
Than borderline.
They're different disorder. I mean, they're in the same thing, but they present differently. Okay. Bipolar 1 is very serious. I mean, we're looking at high highs and low lows. And people who struggle with bipolar disorder, it's usually a dopamine issue in the brain, dysregulated moods. And what's alarming and scary about people who struggle with bipolar 1 is that in the low lows, they are prone to suicidality. And so being very mindful in treating and being on top of the highs and lows is really important with that one.
Wow. Okay. So it's more of like what's going on neurologically with, like you're saying, dopamine, and instead of like what's happening with borderline personality.
And with bipolar versus borderline, bipolar, when we look at the mental disorders, bipolar actually has heavy, what we call genetic loading. There's a few disorders when we look statistically that seem to have a hereditary component.
Okay.
OCD being one of them, obsessive compulsive disorder, and bipolar disorder.
Okay.
Whereas borderline personality disorder does not present to have a hereditary factor.
Interesting. Yeah. So bipolar is more same person, super high, super low, but same personality.
Well, when they're high and low, the personality will fluctuate, right? So it's really it's a mood disorder. When you're dealing with bipolar disorder, it's somebody who vacillates between high highs and low lows and has a really hard time regulating a baseline for just navigating life. And so something will trigger them potentially in their lives, which will lead them into what we call a manic episode. Those are the highs. And then a depressive episode, those are the lows. And so really the treatment for bipolar disorder is to stabilize. You want to mood stabilize them so that they can create some kind of equilibrium and balance in their lives so that they don't go high, high and low, low.
And in your practice, you don't use pharmaceuticals, right? So how would you go about doing that treatment-wise?
Right. So people with bipolar disorder are treated with mood stabilizers primarily. I am not a medical doctor, so I refer out to psychiatry, and they'll refer, a good cocktail of medicine that will help stabilize, usually in that sphere. But when it comes to treating, it's really about stabilization and watching out for triggers and noticing when we call it cycling, when people start to, because you'll notice it ramps up or will ramp down. And so being able to catch it early so that you don't get to those extreme places is where the treatment lives. And really working on regulatory emotional states is key. And that actually sort of spills over into borderline personality disorder. And that's why I think people get them confused a lot, is because there are some parallels as far as being high and low in borderline as well. That's also an emotional dysregulatory thing as well.
And in your practice, tell us a little bit about the different types of treatments that you like to lean on. I know I read you do EMDR. What are the different, there's talk therapy, there's different things. So how do you incorporate those different modalities? Obviously, it's personalized for each person and disorder, but what do you lean into?
I feel like for people, it's really about, a lot of it's narrative therapy. It's like, where did you come from? What happened to you? Tell me about your life. And I like to look at therapy sort of as like investigative journalism in a weird way, because it's pinpointing things of like, how did we get to this place? Because usually by the time they walk into my office, something's not going right in their life. And they need to figure out what went wrong or what's going on. And so we have to backtrack a little bit and figure out where this all started. And so a lot of the work is backtracking and trying to gain some understanding and self-awareness of the etiology of all of these problems that they're now presenting with in their adult life. Where did they come from? And so much of the work I do is like around self-awareness, mindfulness, understanding oneself, and then being able, I think with that self-awareness, it creates empowerment in people, because a lot of people walk in and they're confused. They know something's wrong, they're scared, and they don't understand how to navigate their lives. And so they need to get some way to empower themselves. And so understanding oneself is a way to empower oneself, right? And so that's a lot of the work a lot goes back to inner child work or childhood trauma.
And what sort of lifestyle changes and, mindfulness practices have you really seen move the needle? Because you're someone who's sharing this with people on a day-to-day basis and working with them, which I think is so fun in a way, because you have firsthand experience seeing how these practices can shift people's lives and like different ones. So what has been, something as simple as like walking or whatever it is. I'm just curious, like, what do you love to share?
When you think about, I think self-care becomes a really big thing. And it's funny because we talk so much in our society about self-care and everyone's like self-care, this and that. But it's funny because people don't always know what that means, right? Mm-hmm. Can we define what self-care is? And so when it comes to each being, we're all so different and our makeup is so different and our pathology of our psychopathology of what makes us who we are varies. We're all unique. So what works for one person doesn't necessarily work for another. Some people really find nature, being outdoors, grounding. I'm a huge proponent of just walking outside every day for 10 minutes and just getting fresh air. I like to think of the mindfulness stuff as the little things you can do every day in your life to implement that will add up over time incrementally. It's not the grand journey to go do something. I'd love to go to Sedona and go on a hike and drop in, right? But not everyone can do that, right? That's an arduous journey for some people. So it's like, what are the little tweaks you can do every day in your life? And some people love journaling. Some people love meditating. I'm really into frequencies lately. Do you know anything?
Well, yeah, but tell me more about what you're doing. There's so many different.
Yeah. So in the EMDR world, we're doing bilateral stimulation, right? Which is moving. So people who don't know what EMDR is, eye movement desensitization reprocessing. And so that's basically rewiring old memories in the brain to take the charge out of them. Primarily like acute memories, something really traumatic that happened and that stays with people because it leads to PTSD. So the goal of that is to take that memory, if it's a charge of a 10, bring it down to like a 2 or 3, and then it won't flood them as much. They won't have the same PTSD response to it. And so a really good thing that I love, and this is just a psych hack anyone can do, is if you have Spotify, get bilateral stimulation. There's music that's just created for it. Pop in your head, earbuds, and you can literally be like washing your dishes and listening to that. And what it's going to do is it's going to regulate your nervous system, because so much of our emotional states and the things that we go through is based on our nervous systems. And when they get dysregulated, that's when all the crazy stuff happens, right?
Yeah.
And when they're regulated, people are relatively calm and in a good headspace. So that's a really good psych hack.
I love that hack. Like even with children, I know I want to get into like just the maternal mental health too, but just like putting it on your speaker at home when everyone's there, like when there's little moments like tantrums and all that, even with like kids. So bilateral stimulation is what it's called on Spotify.
Yes. So and I can send it to you if you want to. I don't know if you put it up for people. There's specific music that's created that moves from one earbud to the other. And that's where you create the bilateral stimulation in the brain. And even though you think it's not doing anything, it is. And like I say, you can passively do it. Maybe don't do it while you're driving.
Yeah. Well, so can you do it on the speaker and not your earbuds? Can you do it?
You do need it.
Okay.
Yeah.
Okay, that's good to know. Yeah. And then what's the difference then? But that's like still considered a frequency.
So a lot of the music that they create for the bilateral stimulation, or they're actually called binaural beats too.
Yes, I was going to ask you. Okay.
Yeah. So the purpose of it is they use a high frequency music because that's what really helps to speak to the different areas of the body and frequencies in the body for the nervous system.
So it's kind of like, but it's different than EMDR because EMDR is using like what's it called? Or
Eye
whatever.
movement
Eye movement,
desensitization.
but it's in a way helping reprogram similarly. And then who would you say is a great candidate for EMDR?
I think anyone who's lived through something traumatic or has trauma, which is pretty much everybody at some point. Right?
Literally. And my husband did it, and it was unbelievable. I mean, I was so amazed at how like 10 or 20 sessions could really move the needle and make a huge shift. And I just like with him too, I mean, his whole life he went to like talk therapy as a young child. And then like that, but it was always so difficult for him. And then like EMDR was the thing, because I think some people are really great at sharing, and then others, it's just kind of like this, you know, it's just in their body and they need to release it, and that helps. Obviously the combination is great, but
I think the thing with EMDR is it really brings in the psychosomatic component, the mind body, right?
yeah.
Because that's where the memories are stored, is in our body, in our soma. And so being able to release them through EMDR or reprocess them, it's almost surgical, I like to say.
Yeah.
Whereas talk therapy is great and it has its place. And it's really good for people who are starting out, wanting to get to know themselves, wanting to understand their pathology, why they are the way they are. I think talk therapy is a good place to start. But if you're wanting to target something and work on something very specific in your life, EMDR is great for that.
And where's your practice?
Well, I'm remote now since the pandemic.
Can you do EMDR remotely? Or
you can do EMDR remotely. I don't do it remotely, but I refer a lot of people out to people who do it either in person or remotely, and I'm very familiar with it. And there is another piece to it. There's these tappers. Have you seen the tappers?
No.
They're like these little handheld objects you hold that buzz, they vibrate, and that's where you get the bilateral stimulation.
Oh.
I do recommend people, if you are going to do EMDR, if you can do it in person, not to saying it's not effective remotely, but I think there's always that missing piece of being in the room with somebody, and having that sensory experience with the tappers. So being able to do that and find someone locally would be ideal.
Okay, cool. And then what about biofeedback, and what's the difference between biofeedback and EMDR?
I'm not a biofeedback person in all honesty, because it all becomes so special in all these modalities, but
Yeah.
It is in the same wheelhouse and a lot of people really love it. It really does. It's similar to EMDR in that it targets a specific thing. And so it's really just surgical as well in that memory and that reprocessing of that trauma. And I think when it comes to all these modalities, it's not a one size fits all. Some people don't like EMDR, some people like biofeedback, some people prefer cognitive behavioral therapy, some people like psychodynamic therapy. There's so many different options out there, which is great. And you have to find what works for you.
And with kids now, that because I was reading in your bio that you work with people of all ages. So when you work with children, what's that experience like, especially when it's remote?
So I don't work with kids any longer remotely. When I was living in Los Angeles, I worked at the Well Baby Center, and I worked with moms and babies and maternal mental health, and would run groups there. And it was such a fun time. And then of course I became a mother, so
Yeah.
it was a totally different experience after that. But when you're working with children, I always say the best modality is play therapy.
Oh.
You want to play with them, and you want them to feel comfortable and tap into all of their different feeling states. And play is the best way to do it.
Wow, that's so cool. So they just by playing can move through emotions, and then as the person treating them or working with them, you just understand like what they're going through just through watching them play?
Well, so a lot of times you can create setups and dolls, right? So maybe there's a family dynamic situation happening. Let's say there's a divorce going on and the parents bring the child in for therapy. You can sort of set up with the dolls a house and model it, and then the child will sort of direct, and you'll see them play out the dynamics in the household or the feelings of having to go back and forth between households. That'll show up maybe in the therapy room, but it'll usually be through dolls or through play. And so then
Oh gosh.
it's my job to
Yeah.
analyze it and be like, okay,
Yeah.
that's what they're feeling. That feels, dysregulating or stressful, and they
Yeah.
have to go back and forth. So that's usually how it happens.
My daughter, just sweet, sweet girl. She models, like she'll tell her nanny or teacher, like, okay, I'm gonna leave, I'm going to work, bye. And it's like totally because she has such a hard time detaching from me. She's so young. She's 3 now, but it started when she was like a year and a half. I would like go to work for the day and I would just be like, oh my gosh, my heart breaks because I know it's because it's so hard for her. But yeah, you could totally see her play it out with them.
Mm-hmm.
Like, hey, bye, I'm grabbing my purse, I have to go. And then she'll say, but I'll be back. And then like leave. But it's like, yeah, it's just, I mean, sometimes, you just can't, there's certain things that you can't change. I tried to like change my schedule so I could not leave as long, but leave, get work done, come home sooner, just like witnessing that. But it is so crazy how much you can witness just through their play. It's true.
Totally. And that attachment stuff in those formative years, 0 to 3, or there's so much happening.
Yeah.
And they're figuring it out. That attachment is primal for everything, and that's the blueprint for life. So yeah, she's showing you how she feels.
I know. I'm like, oh my gosh. So in terms of maternal mental health, I think that's such an important topic because especially for me, what I feel like I realized I feel like I never really I went through a lot of difficult things in my life, obviously, and I did have a lot of, seasons of sadness and all that, but I grew up with an older sister who would go and see a therapist that she would talk to regularly. And I don't know, I just worked my way through it and I did work a lot one-on-one, like later after college. But I've always felt like, okay, I was working on myself. I really believe in like ancestral trauma, inherited trauma, and also like just my own lived experience. But it wasn't until I became a mom where I was just like, holy shit, like this is insane. And it's like never ending. Like working on yourself is truly never ending. There's this onion and you're peeling the layers. But it was like becoming a mom is what made me become so much more aware of my mental state. And I just like I really am passionate about talking more about it and how it can, even like if you feel like you didn't have a lot that you were like looking to work on before like becoming a mother, it's just such a mirror, right? And so much more comes up and it's like you can't ignore it at that point because now you're again like going back to self-care, like you're needing to take care of yourself but also raise these children, and especially if you want to do it consciously, so much goes on. And so like what has your experience been? Obviously it sounds like you were working with moms way before and their children, but then now you've become a mom. How much has that opened you up to just understanding what's going on, even like on a hormonal level, right? And like the lifestyle changes that go along with it and all the things. Like what are your, obviously not everyone listening who's a mom can come see you. Like what are the top recommendations that you give to mothers in general?
It's motherhood is a journey. It really is. And I don't think there's anything that's going to shake you as a woman more than becoming a mother. At least that's been my experience.
Yes.
And it's going to change you in so many ways. Whatever you were before, you're going to be some iteration that's totally different. And I don't think there's any mom that doesn't say they have some kind of identity crisis after they become a mom, because it upends everything. And not only that, your emotional world is what you're speaking to gets sort of turned upside down and inside out. And then it's our job to sort of figure out, well, what the heck is going on here? We're up against a lot. There's the hormones. There's our own inner child. I think that's a big piece of what happens to moms. And sometimes it's 3:00 in the morning. You think you're the only person in the world awake, and you got this baby crying in your arms. And all of a sudden, all of these emotions just take over. And I remember that's how it showed up for me, was those late night feeds, alone in a nursery with the crying baby, trying to comfort, feeling so exhausted and also confused. And that's when all the emotions would just show up for me. And I would have a really hard time sorting through them and being like, well, what is going on here? So it took me a while. Now that my kids are 5 and 8, and I'm through a lot of the postpartum stuff, which I think every woman gets some iteration of postpartum. We have to just normalize that.
Yeah.
Sleep debt alone will do that to you.
Yes. Like I'm always like, how is anyone a functioning member of society after like weeks of no sleep, or like in my case, my kids have genetic conditions. So like I literally did not sleep for a year and a half. I like, cause I had to wake them up every 90 minutes to feed them. And I was like, oh my gosh, I'm going crazy. Like sleep is just such a foundation of like having an even mood and just being a functioning member of society. But in general, even like as a new mom, or like the anxiety for me was like when they get sick, that's like, or like the anticipation of your child getting sick, that for me was like, it's crazy because on one hand, I'm like super not into like the germs and like the germophobia and like all that stuff. I'm like, well, I'm good. I don't need to like give them all the medications and all that. And then on the other hand, I'm like, oh my God, if they get sick, then this is going to happen. And then I can't, go to work for a week and like, but I just only care about them being okay. And it's just like all the anxiety, the worry. And when you're in it, it is bad. Like it does suck in some way, but it's also so beautiful to have that coziness and like that beautiful time together. But when they're little, it can be scary.
It's super scary because when your kids are sick, as a mom, I think one of the hardest emotions to grapple with is helplessness. It's that feeling their kid to be okay, and also having inner helplessness around whatever that is. And sickness will definitely bring that up.
I'm so excited to use the different modalities that you've talked about. And I just want to learn more. Like, it sounds like you do have a practice, and we get asked all the time, like, who can I see that is someone who's holistic? And it sounds like, you incorporate so many of these beautiful alternative healing practices into your work. And I want to share it with people. So tell us, like, how can people find you? How can people work with you?
The easiest way to find me is to just go to my website. It's DrElisabethCrain.com. I'm also on Instagram, and it's also DrElisabethCrain.com. Me at those 2 places.
Thank you so much. I'm so happy you came on, and I feel like it would be really fun to just do more. Like, now that people have been introduced to you through the podcast, like, it'd just be fun to let people do some sort of like Q&A together. I'm sure people have lots of questions. So let's definitely stay in touch and talk more often.